And the first brand chat will be done with one of the top, and I would say a senior legend in Indian pharmaceutical industry, Mr. Mohan Motwani. So Mohan sir, please unmute. I welcome you and really, really happy that you have joined us today. And in quickly, let me just speak two or three lines about you. A senior pharma professional and a legend of Indian pharma marketing. He is an advisor to pharma companies. During the 15 years he spent with Cipla, he shaped Cipla into a very strong marketing organization. And I think most of the students that I have interacted with and asked one simple question while interviewing, which company do you remember in pharma industry, or tell me the name of few companies whom you have heard about, Cipla comes at the top. So a strong brand there. Mohan sir, welcome.
Thank you. Can I go ahead?
Yes, sir. So
Can
it's
you
all.
hear me?
Yes, stage is yours. Please share with us how the brands are built.
Good morning, all of you. I think this has been a very enlightening session for me in the morning. What I am going to say, please understand, is not going to be anything new, but support what has been shown and was said by eminent speakers before me. When I was watching or looking at the list of brands shown by our friend Mr. Madhav Gandhi and his company and his associates, I was having a little pleasant laugh. All these brands, I think, were introduced before they were born. Most of these brands have been introduced in the years of 1960, 1970, 1980, correct? And as Professor Vivek Hatangari put it, correct? The top of a mind brand not necessarily reflect the brand as top selling brand. Why this has happened, or why it is happening, and why today's brands are not able to displace these brands or share the mind of the eminent doctors, key influencers. Why? Who is responsible for this? Who is accountable for this? To understand this, please bear with me to spend some time about getting insight of pharma industry, pharma products, pharma brands, our consumers, and our decision makers. Pharma industry is ranked as the top, one of the top or the top most essential industry, essential category industry for nation. Health of the nation is determined by the quality and effectiveness of the pharma industry. Healthy nation can become wealthy nation, not vice versa. Industry has to play a very critical and crucial role in improving the productivity of the prime resource of the nation, that is people. Anybody you ask, who's your prime resource? The answer will be manpower, the human being. Pharma industry has a noble cause and a noble goal to support healthcare professionals' efforts in improving the quality of the lives of their manpower, their patients, relieve them of their illness, helping them to live healthy, productive life. One only lives once. I'm sure all of you will agree on that. So that has to be a healthy, smart way of living. And that is the goal of pharma industry, to help healthcare professionals in alleviating the suffering of patients or suffering of unfortunates and help them to live with sales pride and contribute to the growth of the nation. Please understand, this is the industry we are working for. Hence, our marketing practices cannot be compared with the marketing practices of the industry selling comfort products or image building products. That is why Professor Vivek Hatangari and other eminent speakers emphasize so much about ethical marketing. Now, sometimes I also, think about it, what is ethical and unethical. No, I think marketing has to be ethical. There's no question of marketing to be unethical. What is the purpose of a marketing? To satisfy the unsatisfied needs of the people. Satisfy the partially satisfied needs of the people. Correct? So you have to be ethical. You can't be unethical dealing with lives of human people, human beings. What happened during COVID day pains me a lot. None of the brands used in COVID time and they helped some of the companies made millions were mentioned in the list. I don't think a single brand came here. I was expecting Zinkovic, that was missing. I was expecting Dolo, that was missing. You had Calpol, you had EcoSpray, you had Eptime, launched before my birth maybe. So that is pharma marketing. Please don't get swayed by the marketing practices of others and think that only corruption, giving money will help. That is important to maybe get an entry. To put it very in a lighter way, that is like a muh dikhai for a newly married couple, husband, to give to his wife on wedding night. What happens after that? It's a long journey. Muh dikhai is not the be all and end all. So the money only helps you to get a better entry, maybe to create a better environment so that you can get more time than others with the key influencer. I also question myself why any pharma product should not become a top mind brand. How much money, how many years research, series of tests are carried out before a pharma product sees the light of the day. Do you know that? Out of 1,000 products under research, 999 are failure and one sees the light of the day. And it is a lifesaver. One lives only once, remember that. And we can't play with the lives of people. I can take away the life of a person, but I can't restore that back. That is pharma marketing. That is the responsibility a brand manager carries on his shoulders. He is accountable for his actions to patients and healthcare professionals. He can't take it lightly and just talk about selling like commodities. Today in the newspaper, you read in Gujarat, a couple of people are caught. Lal bottle, that is the Ayurvedic syrup they have been selling. Unfortunately, a couple of them are Sindhis like me. People are dying, contains all methanol. Now Gujarat has a provision. But you have lal syrup sold as an Ayurvedic product, killing 10 out of 100 patients daily. Are we doing the right thing? Is it ethical? Then what is our responsibility? Why are you doing B.Pharm? Why are you doing B.Pharm MBA? You can just get into any industry and start selling the product. In pharma industry, we have a greater responsibility to protect the health of the nation. God gives life to people only once. Our job is to see that we make him live well. You make him become productive. You make him become useful to society. As far as our healthcare professionals, please understand their position. Among the society, they hold the top position. In fact, they are intermediary between mankind and God. Patient treats him as a God in person, God in flesh and blood, person who will rekindle the desire in him to relive, to live, person who will alleviate the suffering of his patient, suffering of the unfortunate or his. He approaches to him as he thinks he is approaching a God. And we in pharma brand management are serving him, supporting his efforts. You should be proud of your profession. You should take pride that you are fortunate, lucky ones to be part of this industry and doing good for the society. All pharma people who do ethical marketing work, I promise you, will go to heaven. In no other profession you get this kind of an opportunity. So industry is very critical for the growth of nation. Human beings' life is very critical. He gets it once, he should be able to do the best. And Hindus, as they say, पुराने पाप खत्म करके स्वर्ग में जाए. Be a good productive person. Patient, rekindle the desire in him to live. Healthcare professional who are most intelligent and respected persons in society appreciate are always under stress. In a split of seconds, they have to make a decision. They are playing with the lives of people. He can't go wrong. He cannot face treatment failure. A treatment failure means a breadwinner is lost for a family. So can we brand pharma people behave irrationally and unethically? No, certainly not. Our goal is not just to help our owners to make money. They are making enough money. Don't worry. Nothing will happen to them if the brand loses its shine. Provided, provided the brand is built. Our goal is entirely different. So understand our responsibility. We are responsible for making the product a brand, for helping the product to find its right use. No product in the industry is approved or sees the light of the day unless it has gone through series of tests and trials and has some beneficial effects. Every product has the beneficial effects, not so good beneficial effects, and the risk benefit effects. So there are only benefits. You as a brand manager has to develop the product inside and help product to reach its right slot. And once it finds right slot with the right key influencer, the product will live for 20 generations. This is Aptine. This is EcoSprin. This is Glycomate. This is Augmentin. Correct? Somebody in brand management marketing has done a justice to this product and helped the product to live to its full potential. Please understand and appreciate. respect product. Suppose I ask you who pays you your wages. What will be your response? My boss pays me wages. Owner pays me wages. Management pays me wages. No, sir. It is product which pays wages. Purpose of organization is to create customer. Purpose of a brand manager is to market a product to satisfy the needs of the user at a profit to the company. Purpose of the management is to organize resources and help brand manager giving the product that he wants. Tell me, in pharma industry, why should a product fail? Product has come out of a lot of tasting and trial. We have a choice to select the product. We are not innovators in India. We are doing copy pasting. We have a choice to select. So our choice should be correct. Our selection should be correct. How can we select a product to market which is selling somewhere else well and then see its downfall ourselves and laugh over it and forget about it? We sold that in COVID, remdesivir, correct. Favipiravir also very correct. So many antivirals. People made money, now forgotten. Most of the stocks got expired and taken back. But owner is not affected because he says in his price I had accounted for 50% returns. Patient is a loser. Healthcare professional loses credibility. Please tell me what are the fears of patient. Now, before that, let me ask you, how do you differentiate product and the brand? Product satisfies functional needs of the consumer or the decision maker and is a creation of the corporation. Brand satisfies functional needs as well as emotional needs of the user, decision maker, key influencer, and is a creation of the customer. Customer builds brands. A satisfied customer builds brands. A satisfied customer is a base salesperson for the brand. Understand that. And that is the difference between product and the brand. In pharma, again, you will find, showed me so many brands. I think in functional differences, the differences will be minimum. Is as good as Calpol, or aspirin is as good as even Zerodol, or whatever the brand you take it, as far as the pain relief is concerned. But every product doesn't answer patient's concern. Patient is concerned about his safety. Patient is concerned about the product, whether it is damaging my other systems or not. Patient is concerned whether I'll be able to carry out these duties regularly for next 20 years. Will I remain useful to the society or will I become a vegetable? Is it safe? Is it good for a long term? The decision maker is concerned that there should not be treatment failure. I should not cause damage to the unfortunate patient who's already damaged or already suffering. I have to be careful. In our time, we used to even tell doctors, for God's sake, do not prescribe my beta blocker, which is non-selective to asthmatic. We used to tell it. Understand? So there was a selective beta to stimulant salbutamol. Now, before we introduce, now let me give you some examples for this emotional needs and the functional needs. We had salbutamol was our flagship brand before I joined, or during the time I joined. And that took the company up, not to a A-grade company. We had introduced medicinal aerosol acetylene inhaler. That was the first time in the country. Otherwise, it was coming or marketed by Glaxo as Vintorlin. We were trying our best to establish a acetylene inhaler, become top mind brand with chase physicians, leading asthmatics, leading chase physicians like Mashu, S.R. Kamath, correct? We are finding it, Udwadia, Farooq, we are finding it difficult to get the share of their mind. Who had left his academic career, great academician and practitioners of marketing research, had started his own, founded his own company, CMAR, were motivated by our guru, Tarun Gupta, who had joined Glaxo, to come and introduce marketing management in associated with Glaxo. After 83, Professor Chitta Mitra branched on his own and offered these services to all Indian companies in the industry. So we used to meet, we used to interact. Tarun Gupta was our marketing guru. And suddenly emerged a question, what is asthmatic patient looking for? What is his tension? What is his worry? He is going to live with asthma lifelong. So what is he worried about? The thought emerged after discussion. Oh, he is worried he should not get an attack during the day, during his meeting with his people, during the time when he is working, during the time when he is traveling, during the time he is on the road, at midnight, he should not be systematic attack. Who will come to his rescue? So we made that as a communication platform. Have a Stalin in your pocket, gives you freedom from attack, freedom from fear of getting attacked. And even if you get attacked, the solution is on hand. The brand immediately got the attention of the medical profession. Maybe functionally other anti-asthmatics were more effective than this, but they had side effects. In those days, those were steroid combinations, steroid with ephedrine and bronchodilator. This was safer. And doctor in hand, doctor in pocket. So brands are built like that. A Ziplocs. During introduction of fluoroquinolones was a major breakthrough in antibiotic therapy in 1980s. Before that, it was amoxicillin, ampicillin, tetracycline, doxycycline, correct? Cotrimoxazole. But there was nothing effective for gram-negative. And patients needed hospitalization immediately. Please know your product well, know your disease well, know for which indication is the prime indication for the product, know who is going to be the key influencer for this product and become brand ambassador. If all these three are matching, your communication platform will become very good and you will become successful and product will become top mind brand of key influencer. So when Ziplocs was introduced, correct, it had injectable form, it has oral form both, correct? But the claim was that oral is as good as injectable. So why you need injection? Ranbaxy focused more on their injections. because they were strong in hospital segment. We were not so strong in hospital segment. We focused more on oral. 100% success rate. No chances of treatment failure. Infections can be life-threatening, and you can't play with the lives of the people or take chance. Functional benefits with emotional benefits. It's the product into the mind of the key enforcer. That is a simple formula to make it a brand. So doctor knew infections, there are cancer patients, they are immunocompromised patients. If he gave them something and something happens, who will come to his rescue? All cannot be hospitalized. Put him on blocks. We'll see later. First, let us control the acute infection. Investigate. These are all symptomatic relief emergency products. And after Ciplox, the Norflox, the Oflox, they followed. So my simple suggestion to brand manager is, first understand your responsibility and your accountability. Your responsibility lies with you. Be honest to yourself. Will you take the drug if you are falling sick? I've seen brand managers, when they fall sick, they tell doctor, please don't prescribe this product. Sir, it is a side effect. अरे आप मेरे पास रोज आते हो, बोलते हो ये लिखो, मैं आपको लिख के देता हूं तो आप बोलते हो नहीं लिखो. Number one. Number two, have a concern for decision maker. Key influencer. Don't mislead him. His one error can cause and damage thousands of people. Better to be safe than sorry. Be clear on what is the prime benefits for which this product is approved. What are the side benefits or co-prescriptions which can be, for which it can be given. And in risk patients, analyze the risk-benefit analysis and then be honest in your approach. Have a deep product insight. Have a empathy for suffering and patients. He is suffering. He has got a fear. Will I be able to live long? What will happen to my children if something happens and I lose my job? So can I give him a drug, or can I push doctor to write a drug which can cause damage to him? I see some of the products today are being promoted which are for arthritis, and now they say they are good in diabetes also. They are good in COVID also. They are good in this also. Arey Baba, you got enough to take care of the prime indication. It is still not used in prime indication. But first promote, establish there. Last example, I think I'm running out of time, is when we marketed erythrocin in Abbott. We first decided that we'll only promote in upper respiratory tract infection, macrolide, though it has benefits in 10 other infections. But we are not there. It has to be used when others fail, when there is no choice, when others cannot take. Injection is given when the oral cannot be taken, not to make money. And then throughout first 5 years, erythrocin was only for otitis media, pharyngitis, laryngitis. We didn't even go down to pneumonia and bronchitis. Therefore, today also, a macrolide is considered first when you talk about upper respiratory tract infection. Though it can be useful in typhoid also, H. pylori also. But doctor associates him with upper respiratory. Doctor associates quinolone with gram negative and broad spectrum and not taking a chance.
but you have shared very, very important insights, which were the basics, which should be the basics and which have to be the basics for anyone attending this meeting. I'll take few questions, Mohan sir, from the chat box. One or two
Acha, you will
questions.
have to help me a lot,
Yes, sir.
little, if I'm little hard
Before
of
you
hearing.
take some questions from the platform,
At this
I
age,
just like
Hare
to
Shankar Das, very good. Yeah. Yes, sir.
I just like to say a few things about Mohan sir before you take questions from the chat box. Mohan sir, he has led Cipla through the most difficult times. He has led Cipla to the most difficult times when there was a boycott on Cipla, and he resorted to courier marketing for quite some time. And the second thing which I still remember about Cipla, though I have not been a part of Cipla, in fact, there are two more things which I would like to add. One is the amount of time a Cipla representative used to spend with a retailer. My God, that is phenomenal. While in most of the sales review meetings of any company, they discussed only numbers. But what was discussed in the Cipla sales review meetings was not numbers. They were trying to find out exactly, precisely through their prescription, retail prescription audit, which doctor prescribes which brand.
Very true. Very
And
true.
they hit the doctor on that brand.
Very true.
The reason of success of Cipla and many other products of Cipla. And the third thing, many of the people may not be aware, Cipla was the first company to introduce to the world, probably the world, I would say, the concept of patient-centric marketing. I still remember when I was a district manager in the 80s, Cipla counselors, they used to sit, qualified counselors, they used to sit outside a doctor's chamber and show the patients how to use inhalers.
Inhaler.
Transition from tablets to inhalers. What a beautiful beautiful way they brought about. My salutes to Mohan sir for this.
No,
I
sir.
never forget this.
It won't be fair for me to take all the credit because my team was more intelligent than me. They used to give me ideas, in fact. And that reminds me, yes, we said we are accountable to patients and healthcare professionals. In fact, the doctors used to sometimes question me, why should I prescribe this product? I'll say, sir, do you want to lose your practice by not prescribing? Do you want to lose your patients for not prescribing? It is to build your credibility. It is for to patient की दुआएं लेने के लिए वो है आपको ये दवा दीजिए पेशेंट आपको दुआएं करेंगे and credit it goes not only for me even I'll say my boss Dr. YK Hamid. If you all know about Cipla, he's today the international figure. His main concern used to be patient ले सकेगा. Will my patient be able to take it? That reminds me, there used to be a disease called Kala Azar in Bihar. It's still there. We used to worry about that. What can we do for those patients there? How can I make a product and give it to those unfortunate patients? That was his thinking. So I think credit goes to him also, who imbibed in us this thought of, looking at pharma brand marketing as something different from selling chana kurma.
Wonderfully put, Mohan sir. And our from Pharma State Academy also, we respect Dr. Hamid a lot. We read about him a lot. We have seen his documentary, and a figure whom we all respect and would love more figures like him in the industry in the future. We all are missing those 80s vibes which you all carry. One question, Mohan sir, and I want you to quickly answer it because it is now all the questions are relating to culture, what is happening in pharma industry. means all are sales oriented. Sometimes it happens sales people are not motivated even with training as well as incentives. Also, customer management affects if not work correctly. So what is the right steps? They're asking for solution. You also know what is happening. We all know people are getting frustrated. These are long back stories. How can we make it relevant in today's scenario? And what steps should be taken? And next presentation is by Sankar Das sir. So this question I'm going to ask him again, because this is becoming one question which is coming to us time and again in all our sessions.
Thank you. Dr. Swati, is it really one question?
Sir, it is a big discussion, but I wanted 2-3 points
It's
from
a
you.
bouquet of questions, correct?
Yeah.
Now, see, I also have experience in seeing this, and everybody wants the easy way out. You look at the presentation which is made by Mr. Madhav Gandhi and his associates, and also by Mr. Chinmay Mitra. He showed in his slide that the lowest price product was not a top mind product. He showed so many examples. Correct? None of the brands where companies is spending money or offering, giving incentive, correct, have become the top mind brand. They might have sold sometime here and there, but their sales have been erratic, not sustained growth. So I think brand managers should not have these fears. They should not be influenced by what others are doing. Have some patience. First thing is you be loyal to your product. You first fall in love with your own product. It's your child. It is the one who's paying you wages. You be determined because the product has come out of research and number of trials and establish the benefit in certain conditions. You first try to focus and earn the credibility and confidence of the influencer in that product. If I'm going to promote it like a Ramban, like a homeopathy product, then surely it will not work, or Ayurvedic product. These are medical, scientifically based products, as Dr. Sunil Deshpande said, who is doctor in pharmacy. Correct? These are not something which you can just give it to anybody and everybody by ja bo tab khao. I'll give you another example. Sildenafil, when it was launched, Ranbaxy launched, Cadila launched, Cipla launched. By that time, by the way, I had Dev Cipla. What is the brand name they kept? Swagra. It starts with the brand name. Kill the product. And you will find the products which you have killed, multinational, bring them back in a new form. That means the product was useful. We have not done justice to the product. So first thing and say is be loyal to the product, understand product well, and have your confidence like mother has a confidence in her children. We fall in love with your product first, then with your wife.
Awesome.
Number two is treat customer concern. A customer's concern is a prime concern. Our doctor, we launched erythrocin. The penicillin was used maximum. Our line was very clear. Sir, would you like to see a patient dying in your clinic? Do you want to take a chance? Yeah, it can be 1 in 10,000. But one doesn't know which is that one. You want to take a chance? Next day, you will have to close down clinic. Our brand managers have to become smart. And customer means what? As the professor Vivek Hattangari mentioned, one is internal customer, other is external customer. First is, to whom should I first promote the product in pharma? To internal customer. Who's your internal customer? field force. Is field force first convinced? Is he having the same I have seen product managers, brand managers detailing a product where you can see from their body language that they do not have conviction. And you want that poor chap carrying bag and selling 100 products to go in the market and promote the product with the same conviction, with the same emotion. Professor Atangari took me 40 years back, 50 years back to our days. Yes, chemist is very important. The cycle is very simple of a brand manager. Product, doctor, chemist, stockist, patient. He has to address all this. I have to be convinced about the product that for this condition is number one. Why Eptoin is selling still? Because for epilepsy and this thing, it is at the top of the mind product, whether they put it, they promote or don't promote. And you'll find today the survey which Mr. Madhav Gandhi must have done with the doctor, they must not have been even born during the period when Eptoin was launched. And it is their share of mind. आप सोचो, अरे भाई ये दिमाग बहुत बढ़िया है, भगवान ने दिया हुआ. It has all solutions. You don't have to ask solution. अरे सोचो यार, ये डॉक्टर पैदा भी नहीं हुआ था और उसको एप्टन याद है. So it is key influencer. V.R. Joshi, somebody known, is a father of rheumatology in India. He is noble. The rheumatologists who are there now, they follow his prescription. They follow the lessons they learned from Dr. V.R. Joshi. Please understand our field. Like grandma's products are used at home by children. Correct? So please understand a product, understand a brand. They build equity for the organization. They bring value to the organization. Brand manager cannot be disowning the product. So you disown. Forget all this. You spend money if you want to a certain extent, if you want to some small part, but that is muh dikhai. We used to have also doctor functions when Professor Atangari mentioned that we had medical reps became angry with me and said, we will not work. I say, okay, you don't work, but I have to work. I am not in comfortable position like you, having a union to support me. So I have to work. And my job is to see that my key influencer and my key patient don't suffer. Even if you don't work, I will see that these two don't suffer. They don't feel your absence. Because that is our objective. That is our motto. That is the purpose for which this industry is. बेचना है तो आइसक्रीम बेचो, बेलपुरी बेचो, वड़ा पाव फेलो makes 10,000 rupees per day in Versova.
No, Mohan sir, thank you. Thank you for that. We all are getting the basic crux of what you want to tell. We fall in love with your product.
So
yes.
In short, product, customer, patient, user, decision maker, take care of them. They will take care of you. Thank you.
Perfect.
Thank you very much.
Perfect. Mohan sir, thank you for giving us your insights. I believe this discussion is going to go on till something major happens in pharma industry with regulations and policy, but these questions will keep coming on. Mohan sir, thank you for emphasizing that brand building is not a short-term thing, it's a long-term thing, and you have to fall in love with your brand and your product to promote it.
Thank you. Dr. Swati, these questions now are ending because the things are changing.
Yes, sir.
Doctors also are fed up. Correct. Everybody is paying them. They don't know whom to pay back.
No, I agree, Mohan sir.
Yeah. So don't worry about it. If you are at it, if Professor Vivek Hatangari and Dr. Sunil Deshpande don't give up their mission and continue to have sessions like this, it will happen faster than you can imagine.
Thank you, Mohan sir.
Maybe when you are alive, not maybe when I am. Thank you.
And these blessings are great for us, sir. We need those. We have been trying our best to keep bringing such discussions to the forum.
Continue.
Thank you, Mohan.
My good wishes are with you all the time.
Thank you, Mohan sir, and thank you for enlightening us with some of the examples and some major issues that need to be resolved in the pharmaceutical industry.